Good morning. My name is Jennifer Robom, licensed clinical psychologist and faculty for the Family Medicine Residency of Western Montana. Today I'll be discussing clinical practice adaptations in the face of climate change, specifically how to talk to your patients about climate change. The learning objective for this segment is to review several approaches to clinical conversations around climate change: patient-centered communication, motivational interviewing, and tailoring your message to your audience. For simplicity's sake, I'll be using the term patient throughout this segment. I do recognize that some health professionals may prefer the term client or consumer, and still others may refer to residents or some other term. Fortunately, the principles that I'll be discussing today will apply regardless of how you characterize your relationship to the person with whom you'll be talking about climate change. Health professionals avoid talking about climate change with their patients for many reasons. Some aren't sure that it's really relevant, though if you're participating in this webinar series, you're probably not one of them. Many are concerned about time, given productivity requirements and the fast pace of many clinical environments. While some experts have suggested that discussing the health implications of politicized topics, such as climate change, can be tricky, they've also argued that the potential benefits outweigh potential risks. One of the most common reasons given for hesitation is lack of knowledge about how to discuss climate change with patients. This segment will try to address that concern. For many of you, this webinar series will have been an opportunity to immerse yourself in the health impacts of climate change, and you'll want to share that information with your patients. You may even be tempted to offer lengthy education, handouts, and resources to your patients about climate change and health in the hopes that this will help them to appreciate the breadth and depth of these concerns. In this information deficit approach, the provider assumes that the patient's lack of action reflects a lack of understanding or awareness of the seriousness of the problem, and that providing adequate information will be sufficient to change the patient's attitudes and beliefs and thus their behavior. Unfortunately, just like when we hope that information alone will encourage our patients to change their health behaviors, for example, to cut back on their smoking, to do their home exercises, or to eat better, this one-way approach in which the provider transmits information and the patient receives it is likely to be inadequate. Worse, it may backfire or build resistance, particularly if the patient denies the reality of climate change. As the coronavirus pandemic has taught us, it's not enough to have evidence and consensus on your side, although it is very helpful for health professionals to be able to speak credibly about the health impacts of climate change. It's not enough to be passionate about climate change or its mitigation. It's not even enough to have your patient's best interests in mind. If you hope to bring about change to reduce the health impacts of climate change in Montana, you'll have to learn how to be optimally effective in your communication with your patients. I already reviewed several strategies for communicating with a wide variety of audiences in the climate change communication section. When we're talking about clinical conversations with patients, how we approach those conversations about climate change will be as important as what we try to cover. I want you all to imagine for a second that you're getting ready to see a patient whose health has already been impacted by climate change. Maybe it's a patient with COPD whose condition is being exacerbated by wildfire smoke, or the parent of a child who's having asthma flares due to increasing allergens. Before you even consider talking about climate change with those patients, what do you already know from your training and professional experience about what enhances conversations between health professionals and their patients? What makes for good communication when talking about potentially challenging topics like climate change? Consider pausing the recording for a few minutes to really reflect on this question. In a climate and health class that we taught last spring for undergraduates and health profession students, they volunteered the following list of communication tips. Keep it simple, avoid jargon, use the patient's language, not yours, leave room for questions and curiosity, avoid judgment, partner with the patient, don't pressure, lecture, give advice, or cajole, meet the patient where they're at, and perhaps most importantly, listen. Note that these are excellent examples of basic patient-centered communication skills and good foundations for more effective conversations about climate change and health. A related approach, which can improve clinical discussions around the health impacts of climate change, is motivational interviewing, or MI. For those of you who aren't familiar with MI, it's a collaborative, goal-oriented style of communication that strengthens personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. MI was developed as an antidote to more paternalistic modes of care delivery in which providers told patients what to do and patients were supposed to do as they were told, usually with limited success. Importantly, MI requires the clinician to engage with the patient as an equal partner and to refrain from unsolicited advice, confronting, instructing, directing, or warning. It's not a way to manipulate or get people to change, but rather to help patients discover their own reasons for change based on their own values and personal goals. This is done with strategic questions designed to evoke the patient's own reasons and motivations for change and respect for the patient's decision-making authority. In MI, the health professional wants to act as a guide rather than being overly directive. The provider works to empower patients by drawing out their own values and reasons for wanting to change, rather than imposing those of the provider. The provider is curious and respectful, honors the patient's autonomy, offers information but only tentatively and usually after asking for permission first, and holds space to facilitate change and further exploration. The discussion then takes on the feel of a collaborative conversation between partners, rather than an interrogation or a one-way data dump. Notably, motivational interviewing is useful when ambivalence is high and people have mixed feelings, when confidence is low and people doubt their abilities to change, when desire is low and people are uncertain about whether they want or need to make a change, and when importance is low and the benefits of change and the disadvantages of the current situation are unclear. In a state like Montana, where only 66% of adults believe that global warming is happening, and that percentage is as low as 58% in one county, the MI approach might thus be particularly helpful. Although we don't have time today to do a thorough review of MI, a few essential skills from the Motivational Interviewing Network of Trainers website include open questions, affirmations, reflections, and summaries. Open questions are questions that invite your patients to talk about their experiences, their perspectives, their knowledge, even their fears, because they can't be answered with a simple yes or no. Such questions can guide your patient to reflect on how climate change may be impacting their health, such as, what have you heard about vector-borne disease and rising temperatures? Or simply, what do you think about climate change? Affirmations help patients to reflect on their own strengths, efforts, and insights. This can reinforce past successes and make them more confident or hopeful about their ability to change or employ climate solutions. An example would be, you have a lot of awareness about ways that increased wildfire risk could affect your lung health. Sounds like you could teach me a thing or two. Reflections involve careful listening, really trying to understand what the patient is saying, and then conveying that understanding back to the patient. A simple example might be, you worry about your son's ability to stay cool in this heat. Finally, summaries are an often underutilized skill that help to ensure shared understanding, reinforce key points made by your patient, and sometimes help to organize your patient's own thoughts for them. I've offered another example here. So on the one hand, you have a lot of friends who don't believe in climate change and you have your own doubts. On the other hand, I've shared some new information today that has you wondering if it could put your health at greater risk. Did I get that right? One particularly helpful MI technique to facilitate clinical conversations about climate change is the elicit, provide, elicit technique, through which the provider first learns what the patient already knows, then seeks permission to offer new information, and then explores the patient's response. You can see an example on the screen. The provider first asks the patient, what do you already know about the health impacts of climate change? Or would you like to learn a little bit about the impact of heat waves on heart disease? If the patient says yes, the provider offers information such as, well, for one thing, prolonged heat exposure can strain the heart and can lead to heat-related illness, particularly for patients like you with cardiovascular disease. The provider might then ask the patient, what are your thoughts about that? If the patient expresses concern about their risk, the provider might then go on to problem solve collaboratively with that patient. For example, talking about the locations of cooling stations in town, ways to lower body temperature, or the importance of drinking lots of water. Finally, when trying to enhance clinical discussions around climate change, it's critical to know your audience and to tailor your communications accordingly, because they may become defensive if confronted by information that runs counter to their worldview. It's important to have a strong sense of who your patient is, who they trust, and what their values are. For example, do they value family above all else? Then you might share with them that children are among the worst affected by climate change worldwide. If they're more conservative, you could talk more about national security concerns due to climate change, or faith communities that are working to reduce carbon emissions. If they value the environment or outdoor recreation in Montana, you might focus on cleaner water or wildfire risks. You may well need to ask more questions and engage in active listening to gain a clearer sense of these aspects of your patient's experience. For those of you who are familiar with the Yale Program on Climate Change Communications 6 Americas, you know that researchers have categorized the American public into 6 groups based on their beliefs and attitudes about climate change. The graphic on your screen is from their latest survey in 2020, which demonstrated that growing numbers of Americans believe in climate change, express concern about it, and are motivated to do something about it. As our students suggested, we need to tailor our communications to meet the patient where they're at. To determine which group your patient falls into, you might try asking them why they think their symptoms are worse right now, or raise the issue of the weather to feel them out, learn what they already know, and see how they respond. If a patient is dismissive about climate change, for example, it probably doesn't make any sense to throw a bunch of statistics at them or to talk about the science. It might be better to focus simply on the symptoms that they're having and to educate them about mitigation measures. Here's one messaging example based on wildfires. Sounds like we're going to have another rough summer in terms of wildfires, and I remember you're telling me how much the smoke aggravated your COPD last year. Would it be helpful to review ways to check on local air quality and reduce your smoke exposure? And another messaging example based on heat. During a heat wave like this, your medication, olanzapine, can make it easier for your body to overheat. What ideas do you have about ways to make sure you stay cool and well hydrated? If a patient acknowledges some belief in climate change but knows nothing about the related health impacts, you might ask for permission to talk about them, introduce information slowly, and then check in with the patient to see how that information is sitting. Here's a messaging example based on allergens. Like you, a lot of my patients are telling me their allergies are worse this year. We've been seeing longer pollen seasons and more pollen in the air we breathe, and that's likely due to climate change. Would you like to learn more about that? And finally, if a patient is clearly alarmed or concerned about climate change already, you can speak more openly as well, perhaps by being a sounding board, steering them toward action steps that they can take, or educating them about ways to become involved. Here's a messaging example based on grief. You've been talking a lot about what climate change could mean for your children's future, and I hear both a lot of grief and a strong desire to do something about it. What action steps, if any, have you already considered? As I shared in the climate change communication segment, talking about solutions is important, and emphasizing the co-benefits of behaviors which both protect the environment and benefit human health can also be effective. Here's a messaging example about health co-benefits. Luckily, some of the steps we can all take to reduce climate change, like walking and biking more or eating less meat, could also help you to manage your diabetes better. Would you like to brainstorm with me about that? Importantly, if you do decide to bring up climate change and your patient expresses doubt, use that information as a sign to shift tactics to protect rapport. Experts have suggested rolling with it, resisting the impulse to convince the patient, confirming respect for their views, and concluding with your own commitment to their health. Here's a messaging example for that situation. I hear you. I know climate change is controversial. I'm always here if you want to learn more about how climate can harm health. But today, let's focus on things we can do to protect your breathing when it gets hot. Such messaging can avoid arguing or conflict as a way to preserve and protect your therapeutic relationship for your next conversation. So, in summary, when bringing climate change into clinical conversations with your patients, it's important to remember that how you approach that conversation is as important as what you say. 3 helpful approaches include using patient-centered communication skills and motivation and interviewing techniques, and tailoring your messages to your patient's values, worldview, and beliefs and attitudes around climate change.